Awesome. Thank you. Okay, so again, this is what's the deal with data? Data fundamentals for nonprofit staff. We are the Capacity Collective, and this is the first in a three-part series about data for FCS data capacity, or for FCS providers to talk about data capacity building. All right, after all of that, here's our agenda. So first, what is data? You know, because every presentation has to say like that. And then why does it matter? Why should we care about data? And then just a little bit of our view that data is a tool. You can use it for evil, but we're hoping that you can find some ways to use it for good. And we're going to talk about our way of looking at data in maybe some ways that are going to be new or different for you, but that we've been finding helpful in our work with community-based organizations like a lot of yours. We're going to talk about what we call a data map and how to create that, and your data stories. What are the stories that we want to tell? Who do we want to tell? And then bringing all that together. So that is the plan for today. A lot. We're going to get through all of it. And definitely, if you have questions as we go, Heather is poised and ready and excited to talk to you in the chat. All right. So what is data? We asked you this when you were registering for the session, of course. And so I'll show you in a minute what y'all said. But when we say data, I think the first thing that tends to come to mind is numbers. All right, maybe people think numbers and some stories, maybe opinions, right? So this is how you all answer that question. Right, and so for a word cloud, of course, the way to read that is if the word is bigger, that means that word showed up more times in your answers. Smaller words showed up fewer times in your answers. And so we asked you, what comes to mind when you think of data? And numbers, important information, right? Those are the three standouts. And of course, right, those make complete sense. And it is important and it is information, exactly. Some others that we saw a lot were things like improvement, which I love, because data can and should be part of your innovations, your improvements that you want to make for your programs. Answers, I love that as well. Ideally, your data can answer your questions, your theories, your gut feelings. Ideally, data should help you answer some of those questions. I also love that I saw story in there a few times, because we really think about data as your story. It's so much more than numbers. It's really the story of the experiences and the lives of the people that you're working with. I also saw the word bias a few times, and I want to say, absolutely. Data can and has been twisted. It's been used to cause harm. And all the more reason we do data capacity building, because we want people to have the skills and resources they need to be able to be consumers of data and producers of data, to understand where the data came from, so you can say, hey, I don't think that's right. Or also that you can produce data that you know is reliable and tells the real story of the great work that you're doing. So thank you so much for all of your answers that came in through there. And really, at the end of the day, data is everything. It is so much more than numbers. It is numbers, of course, and there's a lot of that, but then it's everything. It's the surveys that you give, your intake forms, the logs that you do every time you have a contact with someone, your case notes, the comments, the stories you hear, but even also audio, video, books, images. Data is just so much more than numbers. I mean, especially if you heard oral histories or storytelling, you know that there's so much power in those stories. It's so different and in many ways more meaningful than just numbers. What you do, where you go, everything you buy is collecting data about you, right? Your location being monitored by your phone, all of that is data. All the images we see, the stories we hear. And here's the thing, there's a lot of data being collected all the time, especially right now. And a lot of it is being collected to sell you stuff, right? But that isn't the only reason that we have data. There's so much more that we can do with it, of course. And we really want to be able to use data for good, to help and support. But definitely, don't limit yourself to it has to be a survey, it has to be numbers, when there's just so much more. course, easier said than done, but we'll get on to that. And then we asked in the chat about how data impacts your work or impacts your role. Heather, did you find some interesting things in the chat?
Yeah, definitely. Very related to what you just said, Kira mentioned that she's not a numbers person, that she's not a mathematician. And yes, that assumed relationship that the data is very number heavy, and that you have to be a mathematician to be able to do anything with it. Need to know the numbers to support our program, so we may not be able to continue to serve our community. So making sure that you're understanding who you are and are not serving. I loved Marcus mentioned, I think data is helpful when examining how to improve current processes. Being a process nerd, yes, absolutely. Data impacts how we get funding to continue to support, allows us to help us know if we're helping or hurting the work we do with our participants, and making sure our grants are funded and our bills are paid.
Exactly, yeah, spot on. It's like you knew exactly what my next few slides are going to be. Exactly. I mean, honestly, data probably impacts every part of your role in some way, or if yours not specifically, someone in your program is probably spending a lot of time thinking about data. Yeah, thank you so much for all of your thoughtful responses to that. And honestly, the first time I took statistics, I hated it. I think it's the lowest grade I got in college. And it wasn't until I started working with real data about real people and not just boring examples, like, so sorry, but like baseball stats just didn't do it for me. But as soon as I was talking about real people in real life, I started to care and see data a little bit different. So we, we're eternal optimists, but we do know that data can be painful. It can be tedious, right? And it's been absolutely weaponized against BIPOC communities, against all sorts of marginalized communities. So skepticism is warranted when it comes to data, and we absolutely get that. And today, we really want to talk about how there are some possible benefits as well, how it can be used to maximize impact and minimize harm instead of the opposite. And overall, our humble recommendation is not to just throw out data as a waste of time. I have to say that's probably one of the #1 things we've heard from our clients is it just takes so much time. I want to be there to help people. I don't want to spend my time in front of the computer. And that we get, right? So our humble recommendation will be to think about it with curiosity. When you do see the data, I mean, you're probably forced to collect it to some degree. There's probably some that you want to collect, some that you have to collect. We hope that you can interact with your data with curiosity. What does that pattern mean? How can or should we understand this trend? What can we learn from this? How can we better serve our communities with this information? And data does matter, right? It does make a difference. And for some of the reasons, exactly as you said, why should we care about it? Well, for better or worse, nonprofits, community-based organizations, they get their money from contracts and grants, right? And therefore, you're probably obligated to some degree to report to funders, right? This data is required. And those requirements have really gotten more and more complex over time. They really kind of want you to be mathematicians. This is what it feels like when you sit down to do those reporting, right? And then there's this constant threat that if you haven't turned in this reporting in this exact format we need, then we may stop funding, right? Or you're going to be in breach of contract, right? And then people may lose their jobs. It's sort of a scary thing. And so data really gets lumped in with these very scary things. Oh, I went 2 slides. But data can also help keep you motivated. This is the one of the things we like about it. It shows you how you're doing. Are you actually achieving what you set out to do? Are your clients having those positive outcomes you hope to see? Are they moving in a direction that you were hoping they would move, right? Data can really feel like you're dropping off a bunch of information into this box that's just going out into space, into the abyss, never to be seen again. But when you actually get to see the data, when you get to interact with it, it can remind you why you keep getting up every day to do this work, even when it's hard. Sometimes it feels like it's running uphill. Oh, excellent, doing 2 slides. So it also At the end of the day, it should be helping you better serve your clients. And that to me is ultimately the goal, because that's why we all went into this type of work, is to help people. Right? So I really hope that one of the biggest takeaways from this whole series is that data shouldn't just be for your models and your funders, right? It shouldn't just be about them. It should be about you and the communities you serve, the work you're doing, the communities, right? So data can give you these clues, these evidence, these stories, so you can better serve the families that you work with, the people that you work with. What's great about data is it can give you the real story, not just what funders are asking to see, but what's really going on with communities, needs, strengths, barriers, experiences. So for example, we were supporting a home visiting program a few years ago that found out that as people were in the program longer, they were canceling home visits more often. So for the funder, it looked like a negative, that they were actually performing more poorly over time somehow because they had so many home visits that were being canceled. So it started to look like they were failing and they were having a hard time with that. But what we did is we looked at their data with them, and what we found when we started to actually look at it, and touch it, interact with it, is that the reason people were canceling those home visits is because more of them were becoming employed. More of them were going from part-time to either unemployed to employed or part-time to full-time. And so suddenly they weren't available to be there for those home visits anymore. So on the surface, it looked like, oh no, we have more cancellations, but it was because they were doing well and helping people achieve their goals that those numbers were going down. Right? There's the rest of the story, and the data can give that to you when you're able to actually interact with it. For better or worse, data is evidence. It opens up doors, it starts conversations, it influences public opinion, I hope, right? It should be moving our legislation. It's in our news articles, like data makes your work visible. In the home visiting example that I just gave, we were able to use that data as evidence to go back to upper management and say, hey, maybe people need to change their hours. Instead of home visits only happening 9 to 5, maybe we need to go, to 6 or 7. Maybe we need to move things online pre-COVID, right? So that we can accommodate schedules. It was a big agency, and they probably weren't going to listen to a tiny home visiting program, but because they came in with data, it opened the door to a conversation for policy changes. Data can also show you the gaps. When you collect data consistently, it starts to show you not only where you've been, but where you should go. It shows you if your programs are working better for some people than others. In our home visiting example, caregivers working full-time were losing access to the benefits of the program. Like if everything comes through a home visit and they have to cancel because they have jobs, well, that's going to be an issue, right? So we were able to use the data to identify that gap and adjust accordingly. You can use data to see who's slipping through the cracks. Maybe there are differences based on racial identity, gender identity, or age. Or maybe it shows you there's an emerging need, like, oh, wow, a lot more people are bringing up this particular need than they were 6 months ago. Maybe we need to adjust our programming. Maybe we need to make a different plan. And data can help you to be responsive. It helps you see patterns as they're forming, not 2 years later when it goes through a million iterations, gets sent to the funder eventually sends a report 2 years later. Like it's not going to be good enough to stay agile, right? So collecting data, having it accessible, it allows you to be responsive. I mean, if you think about how many new and unexpected things popped up during COVID, a million things popped up, and they needed responses now. They didn't need it 2 years from now, right? So it's great to have that data. The organizations who were already consistently checking in about basic needs, support systems, they were able to adjust more quickly, right? But it came to, oh, now what you need is PPE. Now what you need is access to testing, vaccines, right? So having processes in place that are already systematically checking in with people allows you some ability to be more responsive. We really see data as a toolbox, right? And again, you can use it for evil, and it has been used for evil, but we really believe you can use it for good. Data gives you the ability to demonstrate. You can show off your successes. You can demonstrate that there's gaps and that you're the best way to fill it. It demonstrates all the good work that you've been doing. And it allows you to demonstrate to internal and external audiences, right? So even your staff, hey, this is how you're doing. Or the board of directors, hey, this is how we're doing. Data lets you celebrate. It lets you actually honor the hard work. It honors the stories of people that have been entrusted to you, and you get to share them out and celebrate the successes that you've had together. Data can help you elevate. It can amplify the voices and stories of those who've been historically excluded. It lets you fill in the rest of the story and elevate those quieter parts. Data can be used to advocate, right? Again, it can be used to demonstrate gaps. They can advocate for policy change, social change. Ideally, it should all be trickling up into system change. And data can help you innovate, generate new ideas, figure out how best to adjust your current programming. So we're going to talk about each of those and getting into the specifics of how to do each of those in the third part of the series, the do more with your data. That's when I want to actually get into all of this. So again, that's a few Tuesdays from now. But if you're interested, Heather, I'll have you put a link in to the do more with your data. That'll be the third session. That one is June 29th. Now my brain is to do the math. Yeah. So that's session number 3, if you want to get into the specifics of how to do each of these. And, again, it can feel like a waste of time. It kind of feels like you're dropping off data into the abyss. And my guess is you're already collecting a lot of data, right? So where does it go? We're going to get technical and nerdy just for a second to talk about some data vocabulary. All right, so starting at the left here, your program probably uses forms. They're paper forms or electronic forms. These are your data collection tools. All right, that can be surveys, regular, again, those intake forms are probably the most common ones you have. Inside of each of those forms, you have fields. So that's some sort of a box, a checkbox, a radio button, something like that that's going to collect a bit of information, a bit of data, right? So the ones that you see most often are going to be names, date of birth, phone number, that sort of thing. Right? This is all stuff that you probably see all the time, but I'm going to talk about a little bit just to give us a shared vocabulary as we move forward, right? So each of those fields is measuring something, right? It's trying to get at a measure. It's trying to measure some sort of concept. Sometimes it just measures it in a straightforward way, like, what is your name? Maybe that's straightforward, maybe it's not, but whether you have a phone number or not, that might be relatively straightforward. But sometimes you're trying to measure a complex concept like housing stability. It's more than one thing, right? There's 5 or 6 things that make up housing stability. So ideally, what you're asking in your field are helping you to measure concept. Right? Let's see. Let's say that your form is a survey that you give after you do trainings, like we do. The participants are going to put their answers in the field. They're going to say they're highly satisfied or somewhat dissatisfied, and that gives us a measure of the satisfaction with our training. So that's ideally what it's doing here. And then where that goes is hopefully an outcome, right? It's the result of the work that you're doing. That's what you use your measures for, is to measure outcomes. So what is the result of this? What types of things are we impacting? Are we impacting people's confidence in their parenting skills? Are we serving the people who need us most? What are the outcomes? And then that data gets reported, right? The first thing that comes to mind is probably the funder reporting, but you can start to think about how are you doing reporting to yourselves, to your staff on how they're doing, right? So you're taking these outcomes and you're curating them in the way that they're a report to show people how to understand the data that you've been collecting. You probably have funders that are asking for monthly reports, quarterly, semi-annually, something like that. And they probably all ask for different outcomes. So your supervisors, program managers, directors, probably a lot of you are the ones that are actually calculating those incomes, putting them in a report to send to a funder or a model. You're probably already collecting all of that data, but it doesn't just have to go to funders and models. You can be using it internally to celebrate your successes, stay motivated, identify gaps, advocate, all of that. All right, so here's just an example of that formula. Let's say on your intake form, you probably all have something that you use kind of like an intake form. You ask a bunch of questions. You probably have a question about gender identity as one of your fields, right? So when you go to design an intake form, when you go to put this together, you have to choose what kind of field do we want to understand gender? Are we going to have check boxes, female, male? Are we going to have check boxes for male, female, non-binary? Are we going to have check boxes for more than that, right? You make that decision. Or you could have a text box, right? That's just an open text box where you ask people to self-identify their gender. Right? Some people use both. They use a self-identified box and they have check boxes because they know their funder wants them to report what's in the check boxes, but they know their clients well enough to know that they want to give the opportunity for people to self-identify. Some people do that for gender, some people do that for race. We know that we have to send the federal categories of race to our funder, but we know our clients, and that isn't always the language they use to describe themselves, so we give an open text box, right? That's the field. So then now that you have that for all of your people, you have a measure of what is the gender identity of the people who are using our services. You combine that data from all the people and you're able to measure how many women are we serving, how many men are we serving, how many non-binary individuals are we serving. And once you have that measure, you can start to look at the outcomes of your program. Like maybe, oh, look, it's 40% of the people enrolling in our program are women. Or, I mean, you can look to see, is that number going up or down over time? Or you can see who's benefiting from our programs more. People who identify as female, male, non-binary. Maybe you can start to see, wow, it looks like more and more people are identifying as non-binary every year. Do we need to do something in our programming and our services to make sure that we're adapting to that and that we're ready for that? Okay. And now you have, because you've asked those questions in the field, you now have this ability to report to funders. And I know some folks on this call are your funders, but I will gently say, sometimes you have to tell the story, whether they're asking for it or not, you know. And so you can say, I know you're asking for female and male, but I want you to know that we also have this many people identifying as non-binary. You need to be adapted to that, right? So being able to report again to internal and external audiences, it all connects back to that field. So how you ask a question in the beginning really gives you the ability to tell a story later in that report. All right, and then where does that all go, right? Again, why should we care about all this, right? You are probably sending in data to funders. And I have to say, a lot of our clients over the years have just said, oh, again, it feels like a waste of time, which I get. It can be kind of painful and kind of tedious sometimes, but it is asked for, it is required, right? So even if it's feeling punitive, or even if it feels like you're being scrutinized, hopefully there's also some good that can come from this, right? And when your funder is a government agency, again, with all of the love in the world, it can sometimes be a special flavor where it feels like you're being asked for a lot. And it doesn't always, the data you're supposed to give back doesn't always align with your values or your definitions of success, right? Your definition of what is a positive outcome. But on the other hand, if you are being funded from a government agency, the data should be reported and it should be shared widely because we want transparency from our government agencies, right? So ideally, the reason that you report back to funders is, like the government agencies, is because it should shape future policy. They should have real accurate views of the work you're doing so that when decision makers go to make decisions, they have an accurate view of what's actually happening in life. So as tedious and painful as data may be, hopefully it's it's part of something bigger when it gets combined with everyone else's data, right? So you have your report, you send it off to the funder, they put it with everyone else's data, and then they put out these reports to the public. One of our funders that we work with most often is through King County, the Best Start for Kids initiative, and they have these data dashboards where every time we do reporting with our clients, they combine all of their data together, that they put it on these data dashboards, and that's what any person can use because it's a taxpayer-funded initiative. Anyone can go and look at those data dashboards and see the real story, supposedly, right? But that story that's going to be made public is only as good as the data that goes in. So if you are going to be receiving the funding, participating in the initiative, to me, there's a little bit of a motivation to tell the most accurate story possible so that decision makers have that available to them. Again, sometimes easier said than done, but that is part of why we think it's important to give data the time and energy it needs so that you can actually show the real lives what's going on. All right. We're going to talk about more specific. It feels like this is early for a break, but the next part is going to be like intense. So let's take a little bit of a break. Let's say come back at 11:45. So it's about 6 minutes. So you can, if you want, turn off the camera, relax. Heather, if you don't mind recording, or up there, do you want to read my mind? Exactly. Thank you. All right. Thank you so much for sticking with us. All right. Okay. So we are hoping what we can talk about today is giving you some ideas of how to look at your data in new ways, right? We know that you're already probably collecting plenty of data, but how do you take charge of your story? How do you make your data more meaningful? Instead of just data being something that you have to send off to funders and models, how can you actually make it meaningful for yourself, for your program, for the families you serve? Our first tip is really to think about how to carve out time and space to think about data. Easier said than done. We're all incredibly busy, and it seems like, yeah, the best, most innovative work we're doing means that we have even less time. And so it's definitely a challenge. But consider setting up, first step, consider really setting up a free consultation with us so we can talk about how to actually make that happen, because it is incredibly challenging. But ideally, just finding a way to weave in that space and time to think about data so that you can start to capture and leverage the power from it, right? So carve out that time and space as best you can, but also bring the right people to the table. Look across all the levels of your organization. Invite current clients, former clients, look to staff who used to be clients. Really utilize the experience and expertise you have in-house. Right? A lot of the times decisions about data, if they are made in-house, are made by people who never have to collect the data or rarely touch it, right? We really love to invite, especially direct service folks to the table when we're going to make decisions about data. So really think about who could be a good data team for you. We have these resources on our website. They're one-page handouts. We call it Empower Tools. We specifically have an Empower tool that talks about how to build equitable teams when you go to make decisions about your data. So feel free to help yourself to the tool if you think that'll be helpful. Also, that resources page of our website, there's a whole page of Empower Tools. Please, they're all freely available. Help yourself to anything that you think might be handy. Heather's dropped specifically a link to the building teams tool, but help yourself to any of them. And that QR code and that URL, those will both take you to where those empowered. Please freely help yourself. All right. So once you've carved out that time and space, which again is much more difficult than it seems, and you put your data team together, there's two processes that we want to talk to you about, and together we call them a data review. So a data review is literally that, just reviewing your data. And we also have an Empower tool about that. So we'll have Heather drop that into the chat. And again, please help yourself anything in there. Yeah, so the data review includes these two processes. First, to create a data map, and I'll get to the specifics of that, but that's really systematically looking at all of the data you're collecting. And then second, create a story map, create your data stories. What is it that you want to do with your data? Well, for the rest of today, that's what we're going to talk about is those two. And again, help yourself do the data review Empower tool. We also have a template that we use when we do data reviews. It's a Google Sheet. Please help yourself if you want to take a look at that template, if you want to use it. Our only request is that because it is a template that's free to everyone, we're hoping that you'll just do a save as or make a copy before you make changes so that the template stays intact, but help yourself freely use it as much as you'd like. The template is actually, it's a logic model. We can get into more of that later, but help yourself if it is helpful for any of this. Okay. All right, so a data map, that was the first process that I suggested. We suggest systematically, methodically going through and understand what are you actually collecting. Create an inventory of what you're collecting and really look to see, are we collecting this because we have to? Okay, but do we still need to? It's amazing to me how many times we are still collecting data because that one funder told us we had to 10 years ago, right? Almost everyone has a story of collecting something for United Way, and United Way doesn't fund them anymore, but they still have that form out there, right? So what do we really still need to collect that? Is anyone asking that? How are we using it? Do we need it, right? Then also, what can we learn from this data? Beyond just it being a zip code, what does that tell us about the location of our services? What does that tell us about how far people are traveling? What are the things that we can do with those bits of data? And when we look at it, if we collect it in this way, what's missing from the story? Are we missing people who identify outside of male and female? Are we missing something about, the disabilities that people have? What else needs to be part of the story? So go through all of your data collection instruments, your forms, your surveys, your assessments, and your screening. Those are data as well. The household information you collect, all of the contacts you have, events. Sometimes you collect data at events, maybe not, maybe you do. And also, of course, think about data beyond the numbers. Look at all of the ways that you collect stories and narratives, like case notes or something like that. And in most of our cases, we're collecting data in a lot of formats. So think about each data point you're collecting, name, zip code, each time you're collecting life updates. Really organize it in a way where you can look at the data. And there's a tab in that template that we dropped in the chat that gives you an outline of how you could map out that data. We love spreadsheets, of course, we do it that way, but you could find another way to do it. We used to, in the beginning, just print out a copy of all of the paper forms, and we just kind of go with highlighters. We'd say, oh my gosh, we're asking for address 4 different times during the intake process. Or wow, we just asked somebody to say their first language 3 different times. We really need to ask it 3 times, right? So look for that repetitiveness, but also just ask, do we really need to ask? You don't have to be as nerdy as us in spreadsheets. To really take a look, what are you collecting? You probably have tons of demographics. You probably have information about people's employment or education, or what concrete needs they have, like I need access to this, or I need to go to a doctor, and this, right? What goals they may have for themselves. You're probably collecting some, if not all of those, right? And then look at about whom, right? These are the columns that we suggest for that, for the data map. Actually, what are you collecting? About whom are you collecting that on? How often and when? Like at what point in service? Right, so we ask that one time and that's enough, or we ask that one time at the beginning, one time at the end. We ask every year, whatever, right? So just really map out all of the data you're collecting, how, when, all of that good stuff. Again, you're creating an inventory, right? And then keep asking yourself, what are you learning from this data you collect? When the data comes in, what do you wish you had differently? Is it enough the way it's coming in, or is it time for us to rethink what's coming in? I also suggest really, and this is going to be easier at some organizations than others, but think about what other data you may have access to. In your organization beyond your program, are there other people collecting pieces of the story of the people you serve? Is human resources collecting information? If you have grant writers or development, what data are they using to apply for funding? What are you collecting when you go to community events? And then even beyond that, what are public agencies collecting? People who collect data related to your communities. What do they have? What's out there that we can access? And a lot of that is publicly available, right? So maybe the city of Kent has some data that's helpful, or the Department of Education, right? There's always going to be something out there. And we have a page of our website that we list just dozens and dozens of public data sources, city, county, state, national, freely available public data. So I'll have Heather drop that link in the chat as well. So help yourself if there's anything in there that's helpful. But yeah, think about that when it comes to your data map too, because that's helping you tell the story as well. So when you have your data map, we then say it's time to talk about your story map. So once you have this idea of what you're collecting, look at the story of the program, of your program, what you're doing, right? Again, give yourself the time and space to step back and ask, what do we wish we knew about our story? Not just because the funder wants it, not just because the model wants it if you use a model, but because you care and you want to know if you're even doing what you set out to do. Because you want to advocate for your clients, because you know the communities you serve are more than numbers, right? They're more than their needs. We work with full, complex human beings, and we really want to make a difference. And so it's good to take that step back and actually look at your data. Those can also be really big questions, and you don't have to start from scratch. So let's talk about a few places that can get you grounded in this question. What do you wish you and others knew about your story? One of the first places you can start to think about that is to look at your vision and your mission. Those are things that have already been established probably at some point for your organization. I'm guessing most of you have them, if not all. So one of the biggest questions we get from our clients is, how do we know we're even doing what we said we would do? And so we really suggest going back to that vision and mission, tell you, this is what we said we were trying to do at our core. These were our ultimate goals. So I hope it's okay for the fine folks from Pure Kent, but I randomly chose one of your organizations, and I went to your website, and this is what it said right up front on the beginning of the very front of the website. It said, Pure Kent cultivates powerful, healthy lives by providing peer emotional support and development services to the South King County community impacted by addiction and/or mental health, with additional focus on justice-involved individuals and families. Beautiful. So that is, I bet that is very similar to what a lot of you are setting out to do. So how will Pure Kent know when they're achieving this mission? Are they collecting the data that can tell them that? So this is what we do. We look at a vision and mission, and we look at it, we sit there and really scrutinize, what is it that you said you wanted to do? And that helps you take that step back and say, are we actually measuring what we said we want to do? Right? It helps you understand, are you achieving your mission? So Pure Kent wants to cultivate powerful, healthy lives. So if we looked at this, we would ask Pure Kent, how do you define cultivate? How do you know when you're cultivating people's lives? How do you define powerful lives? How do you define healthy lives? How do you know you're achieving both of those? How will you know it when you see it? You provide peer support, emotional support, developmental services. All of those are in that sentence, right? What does that entail? Are you meeting clients' emotional and developmental needs? Who is considered a peer? It also says it's for South King County. How do you know if someone is a part of that community? Is it geography as of today? Is it time spent in that location? What do you mean by that? How do you know if someone has been impacted by addiction and or mental health? How do you measure that? Those are very complicated concepts. So how are you gathering that story? How do you know if someone is justice involved? What constitutes a family? Does that include chosen family? Right, so these are all questions that you can ask to really get a grasp on what is it that we're setting out to do, and you can start to operationalize, is what we say in the research world. You can really start to define what you mean by those. And I don't mean to say all this to overwhelm you, but to get you thinking about the complexity and the power of actually measuring these things and being able to report back to yourself and your community. Here's how we're doing. Here's how we're cultivating powerful lives. This is how we're cultivating healthy lives. This is how our peers provide emotional support, right? You have a beautiful story to tell, I guess, right? And it comes down to being able to capture that with your data. So then, again, not meant to overwhelm you, but look for these concrete things you said you would do and think about how could we measure those things, or how are we already measuring those things? In a lot of cases, you're going to see you're already collecting the right data points. It's probably a matter of looking at them in new ways or curating them in some way. Look at all the things you can tell with the data points you already have. So right now, you probably ask for something like an address or where you've been staying. That can tell you if your clients are in South King County. Maybe you collected at zip code level, maybe you collected at neighborhood level, right? Something like that. Yeah, it says, where have you, if it's a shelter, if it's on the street, there's still probably a location or a series of locations where you can start to see, are people part of the South King County community? Okay. What programs people need that they ask about, what programs people actually access, that can tell you that a lot about your story, about what people need the most and what people are accessing the most, right? You can take a look at your data that you're already collecting. A lot of programs collect client goals, which can give you a great picture of clients' progress over time to see if your services are indeed developmental. Right? If you want to know if you're actually cultivating powerful and healthy lives, you need to know where people were when they started and where they were after some time in your services. So maybe you need to talk about a pre and a post measurement of people talking about how they're feeling about their lives or reporting about their health, that you can see, yes, once they've worked with us, they felt better about life or their health improved, right? In some instances, you may need to supplement with a few more data points, right? Like you maybe aren't doing absolutely all of these, right? Or maybe you need to just make a change to how you're already measuring something. Like maybe you ask a substance use history, which I think is pretty common, but maybe you want a way to be able to really understand some of the impact of that history. So you start to ask questions more nuanced than, did you have this history, but what were some of the impacts of that history? So first, right out of the gate, you can direct your services and resources accordingly, but also you can better track changes over time to see if you're making an impact. So really look at how you're collecting things. And I would also say, look for how you're asking in terms of your relationship with folks. A lot of people want to collect mental health history, which of course makes great sense. But I would ask, is it a diagnosis that you need to know and why? Or is it that you need to know the impact of a mental health history or the barriers because of a mental health history? Is it helpful to know the medical diagnosis, or is it more helpful to know about the lived experience? So again, it's worth, when you start to look at that data map and a story map, you can start to look at, do we really need to ask it that way? And is it helpful and all of that? Honestly, it's a good exercise for making sure that your data aligns with your values. Is the goal of your organization to know about diagnoses, about disabilities, or is it to know about barriers and accommodations, right? So really thinking about how, the story you want to tell and making sure your data aligns with that. So that was your vision and mission. I think that is a good sort of thought exercise to go through your vision and mission. Are we even collecting what could tell us the story of the work that we're doing? And most of your organizations already have something like a theory of change, maybe not all of them, but you probably have something like a theory of change or a logic model, something like that about how you were hoping to impact some short-term changes, some long-term, some medium-term changes, some social changes, some systemic changes. If you're not familiar with the theory of change, it's used usually to map out the impact you want to have with your programming. Here are the social issues that we're facing. Here are the activities that we're going to do. This is who we're going to work with. And here are the outcomes that we hope to inform over time, right? The template that we gave a couple of slides ago, that actually can help you build a theory of change or a logic model if that's helpful to you. But otherwise, you can just use the other tabs, because we're not going to go all through a theory of change or logic model here. But I suggest doing a similar exercise as you did with the mission and vision to really look at the outcomes you're hoping to influence and overlay that with your data map. Are we collecting the right information to even tell us when we've achieved those goals? How are we going to know that short-term, medium-term, and long-term outcome happen if we're not collecting this map? And so it's good to really, again, take a step back and look at it through the lens of data. So again, we have this template. If you want to use it, I'm having Heather put it in the chat again, just in case, but again, remember to make a copy to help yourself otherwise. Again, kind of a nice thought exercise for thinking through your data. And of course, if you want to come and meet with us, either on Thursday or for a one-on-one consultation, happy to look at this together with your organization. All right, then I really think it's worth doing the exercise of defining what you mean by success. Again, it shouldn't just be because the funder says this is the definition of success. There may be ideological or philosophical differences between your community's values and the funder's values about certain things. Like, I think there's a lot of funding to say that breastfeeding is mandatory, that you absolutely need to get everyone breastfeeding, but not everyone wants to, and not everyone can. So should the definition of success be a high breastfeeding rate, or should it be a high breastfeeding rate for folks who want to, right? So you should, as a program involved, and all the more reason why community should be involved in your decision making, you and your community should be deciding what is success for us. And then how do we know when we're doing well? And again, that can be sort of an overwhelming question. So we love our Mad Libs around here. So we suggest the sort of thought exercise, or this is how we start thinking about it. We know things are going well when. And that helps you really start to define what you mean by success. Does it work for you as a program? Does it work for the communities you serve? Okay. What does it look like? So then we like to break it down by the key communities you serve. All of the communities that you've said you want to have an impact on. We found this to be really helpful for thinking about success. We know things are going well when participants who have justice involvement histories. What does it look like for them? For children of parents with justice involvement, what is success for them? How do we know things are going well for them? South King County residents, our peer support providers, our staff. Liz again was using the Peer Kent example, so thank you so much for letting us, without even telling you, borrow from your program there. But really look at all the key communities that you serve and connect it back to your mission and vision, your theory of change. Think through all these groups. How will you know when they're doing well? And please don't forget your staff, your volunteers, paid or otherwise. They are crucial to the success of your program. So your definition of success should really include your people as well. So for example, and I really made these up. My apologies to Peer Kent if this is not your definition of success. But perhaps one outcome is that participant with justice involvement have access to jobs with living wages. Maybe that's one of the things that you want to inform. Maybe that's one of your ideal outcomes. So maybe that's your definition of success. Whether or not they're employed is one thing, but do they have access? The children of parents with justice involvement. Maybe an ideal outcome is that they're graduating from high school at the same rate as their peers. One of the things that I remember from criminology was that people whose parents have been incarcerated are much less likely to graduate from high school. So maybe that's an outcome that you hope to have an influence on, right? Maybe South King County residents, maybe for you, success is that they know you're there and they know what kind of services you offer. Maybe what your peer support providers need is to feel appreciated with us, and we appreciate that, right? Maybe that's your ideal outcome for them. Maybe your staff, for them, success is having the resources to protect them from secondary trauma, right? Because we know that, of course, is a huge part of this work. So it's really, again, that thought exercise. How do we know we're being successful on our terms? And then again, you can start to really tie this into measurement. How are we going to measure that concept? Again, overlay these stories with your data map and see what you have, where you might want to add a measure or change a measure. If you want to understand if justice involved clients have access to living wage jobs, maybe you are already doing goal tracking. Maybe you want to do goal tracking. Many of our clients track some sort of goals about education and employment or some aspect of self-sufficiency. And it's great for watching change over time. And it's also great for celebrating those micro successes. Maybe you didn't graduate from high school immediately. Maybe that's not the milestone we're looking for. Maybe what the milestone is, the little increments in between here and there. To see if children of parents with justice involvement are graduating from high school at the same rate as their peers, maybe you do an annual family survey and you ask for milestones such as high school graduation. For the South King County residents, how would we know if they know the services we offer? Maybe you do a community needs assessment to help you answer that question. So forth and so on. Note that these aren't all surveys, because surveys don't work for all communities. They're not always culturally responsive, which is what we're going to talk about at the next session, the second one. It's good to use different formats. And just to note that if you want to know if an outcome is more or longer or greater, you're going to want to take a baseline. You're going to want to have a pre and a post so you can see change over time. So again, if you want to get into the specifics of your organization, please come and talk and we can figure out how best to make that happen. All right, the next step then, you've looked at your mission and vision, you've looked at your theory of change, you've defined success. Now it's good to define your audiences. Who wants to hear your story and who needs to hear your story, whether they're asking or not, right? You can really start to unlock the power of your data when you start thinking about who should hear about your story, right? There are people in groups with whom you want to be able to share. So really take that time and space to think that through. But again, it's kind of a big question. So this is what we use to think about that. Putting your program at the center, your audiences, it's helpful to think about them in layers. You have your internal audiences, or we'll start with your direct audiences. Those are the people directly involved in your program, the staff who are working there, your current clients, the people who are most impacted, right there at the center. Then you have internal audiences, your upper management, your board of directors, something like that. And then you have these community audiences, all of South King County, prospective clients, right? And then you have these bigger picture audiences, funders, models, policymakers. So again, we talk about this in the Empower tool. So if you want to be able to do this kind of thought exercise with your team, it is good to think about who do you want to share this story with? How big of a difference would it make in the lives of staff if they knew what the data looked like? How good would it be for South King County if they knew what was going on with your story? I really think about who can, want to, who should be hearing the story of what's going on in your program. So it's helpful to articulate your audiences, and you may want to do it for each of your programs if you have more than one. So in that direct circle, again, you're going to have people like clinicians, home visitors, if that's who you work with, your peer providers, your direct service staff, the clients you serve. For internal audiences, supervisors, managers, directors, board of directors, What do you wish they knew? The board is partly an internal audience and partly community audience. Let's get to think about that. At the community level, again, you've got prospective clients, other peer agencies, donors, all of that. And then big picture, what do you wish funders knew about your story, or models, policymakers? What do you want to tell them, again, whether they're asking or not? And then here's where I think it gets fun. You take it to the next level. Once you really think through who wants or needs to hear your story, it's helpful to start to think about what part of the story is going to be best for that audience. What is going to speak to them? How you speak about your work to community is probably different than how you speak about your work to legislators. Whether that's good or bad, that there is a reality to speaking to your audience in a way that they can hear it, right? So for direct service staff, what keeps them motivated, right? Again, we talked about this before for each audience, but now I say for each audience, you want to think about how can we demonstrate to that audience? What would we celebrate for that audience? What should be elevated to that audience? How can we advocate based on that audience? How can we innovate with that audience, right? Really thinking through so if your audience is your direct service staff, think about what's going to keep them motivated. And it's amazing that your direct service staff are usually your primary data collectors, but almost universally we hear from direct service staff that they never see the data come back to them. They never see what happens after they put it into the black box. Therefore, they don't know what the successes are. They don't know if they're doing what they said they were going to do. They know they have gut feelings and they can see it, and there's anecdotal evidence, but they don't get to actually see the data, which can be a tremendous motivator. What do your current clients want to know? How can you demonstrate to them that it's worth their investment, their time and energy? How do you show innovations with them, right? So it's good to think through with every audience, all of the possible scenarios there. Again, this can be a little overwhelming, so we've got another Mad Lib here. Thinking through your audiences, we suggest the filling in of the blanks. Like as a direct service staff, I need to know blank so I can blank. As a grant writer, I need to know blank so that I can blank, right? And really thinking through, is it a demonstrate, celebrate, elevate, advocate, or innovate? So let's see. Oh yeah, I was going to say that we have a tab in our logic model template, or that the data review template that we sent, that actually gives you a space to build these story maps. So if you want to use that template, even just for that tab, it's the people tab. You can think through for your audiences, what data would you give them so that they could do some sort of action, right? So again, feel free to help yourself to that. So let's try a couple examples. All right, so let's say, as the grant writer, I need to know the most common barriers to getting secure housing so that I can write a grant to start a program, or so that I can write a grant to make this change to your program, expand or change, right? So that is a story, a data story. This is something we want to be able to do with data. This is the goal. We want our grant writer to have access to information about housing barriers so that they can write grants to innovate, right? Here's another example. As a program manager, I need to know who is more or less likely to graduate so I can identify who slips through the cracks, who isn't working, who is this program not working for, so I can better serve those folks, right? Maybe I need to make a different service. It helps you innovate, right? Maybe I need to make a slight change, or I need to change the number of contacts we have with some people. Your data can tell you this if you ask the right questions, right? So that's a story you want to be able to tell. This could go into your story map. As a director, I need to know success stories because I want to keep our program top of mind with the board. I have no idea if this is one of your goals or not. This is really just me making guesses based on what I've heard from clients. But what I hear a lot is, well, because we don't specifically work with children and babies, man, we've become such a low priority for the organization. So as a director, I want to be able to have those success stories at my fingertips instead of going, hey, does anyone remember a success story? Is there anything I can put in the report? You want to be able to have those easily accessible so that you can share those with the board of directors, so you can have those ready for your report. As a peer provider, I want to know what barriers people are experiencing to being able to meet with me regularly. Therefore, I can use that data to adjust my approach, suggest different locations, maybe change the format of how we're meeting, right? By collecting some of that information, you can be responsive. So again, thinking through all of your audiences, what do you wish they knew? And what do you wish they could do with that data? And that gives you a map of the stories you want to be able to tell. For a person leaving incarceration, maybe what I need to know is what are the case studies of former clients, so I can know, are you the right program for me? Is this going to be a good fit? Can I entrust you with my limited time and energy and build a relationship with you, right? Maybe by being able to see some of those stories, some real life stories, the good, the bad, and the ugly, I can make some informed decisions about how I want to engage with your person. And ideally, as a legislator, I'd like to know about the disparities you're seeing so I can support legislation to address those issues, right? Hopefully your data is not just staying in-house, but it's being used to actually advocate for the social changes that you want to see. How can you demonstrate some sort of a gap or disparity so that you can say, this is the policy change we need to address that? So the thing about talking to legislators, though, is you are sort of forced to speak the language of policy and law. And that's not always a comfort zone for people in social services, myself included, but you are the expert of how people are experiencing life right now. And social change happens through both heart and mind. So data is great to speak to both the logical, the data, the numbers, but also the stories that can really tug on your heartstrings. So your data has all of the chances in the world of moving mountains if you are able to sort of collect and curate the story in the right way. So then you put it all together, you have your data map, your story map, and you're able to just look at it and say, okay, here's what we're already collecting. Here's what we need to collect differently. And here's what we need to add. And hopefully you're not adding a bajillion more forms, right? Nobody wants to spend their whole life collecting more and more data. But maybe what you can do is choose right now, here are 3 more things we could add to our intake form, or 3 things we could take off because we don't need them for that funder anymore, but we can replace with this. And that will set us up in the future to be able to advocate or be able to innovate, right? So again, feel free to use the template if that's helpful, or feel free to come and meet with us and we can kind of brainstorm some other ideas about how to do that. But ideally, bringing together your data map and your story map can help you find opportunities to actually leverage the power of that data that you're collecting. So now, honestly, that's sort of the end of the presentation. So I'd love to know if people have questions, ideas, thoughts. As you can see, data is kind of a big deal. It's pretty cool. But if you want to be able to continue the conversation, since we just have 8 minutes left, please feel free to come to the drop-in support hours. Those are each Thursday that we have a webinar from 11 to 1. So starting this Thursday, 11 to 1, I'll be hanging out. I would love if you were able to RSVP to let me know you're coming and maybe what you want to talk about so I can best be prepared to get all into it. I will, yeah, so, and just a reminder that we've got the 3 webinars. The first was today, you survived it. The second on June 13th about centering community in your data, that community is more important than funders, when it comes to your data, and how to keep the community needs and experiences centered in your data collection processes. And then on the 27th, how to do more with your data. Yeah, thank you so much about the captioning. There's a question in the chat about save it and dropping it in the chat. We can also get the transcript. Yes, the link for the survey. Heather will do that. Again, drop-in hours are Thursdays, 11 to 1. Ask anything, let me know you're coming. And then feel free as an individual or team to sign up for the 1-hour consultation. If for some reason you can't find a time on my calendar before the end of June, which is when the funding for this project ends. But if you, if you can't find a time, by all means, let me know and we'll find a time that works for you. This is important to me. And honestly, I just love to know how you're doing. And we want to be able to report back to Value or to Commerce on how this training went, what types of things you're facing with your data. We'd love to be able to give feedback to them and recommendations. So yeah. By all means, please take the minute to fill out the evaluation. And if you have any questions, thoughts, needs, anything, share them now. Or come see us. We're thankful for you. Thanks for giving us an hour and a half out of your busy lives. Thank you, Heather, for dropping all of these things in the chat. I appreciate it. Yeah, thank you all so much. Hopefully we'll see you Thursday and the next 2 weeks or next few weeks.